Hi, I'm Art Caplan. I'm at the NYU Grossman School of Medicine, where I run the Division of Medical Ethics. Well, it's hard for me to believe, but fluoride, as we know, is present in the water supply of many parts of the world, is become an issue again because RFK Jr., who is a candidate for head of HHS, put the issue back in the news because he's been a long-time opponent of adding fluoride to the water in the US. I thought this is a settled question. And uh, the fact that it's come up again as a subject of national debate is very troubling. Look, the evidence, and this can be shared with both patients and the public, that fluoride helps prevent dental cavities and worse, oral health problems in children has been stacking up for decades. It is very clear that prevention by putting fluoride into the water supply works. It's also pretty clear that the only real danger from doing this is that you get some teeth discoloration if the dose is high. In fact, the reason people realized that there was fluoride in the water to begin with is that it's naturally present in some water supplies. And people noticed in some towns many decades ago that discoloration of teeth was occurring because the fluoride levels were high. There are occasionally efforts made to lower them to get them down to safe levels so you don't get that cosmetic side effect. But what I don't think is really understood is that the battle over fluoride actually never went away. There are plenty of communities in Florida and Oregon that I'm familiar with that every year people who worry about the safety of fluoride or don't like having it, quote unquote, forced upon them in the water supply try to get it taken out. And there are cities like Tampa where they came very close years ago to winning and getting the water supply changed. I don't think there's any risk here. I think those efforts reflect a weird fear about just the government meddling in something as basic as water. But there it is, the elevation of the issue now to a national dialogue again is just because it's been fueled by a prominent person, but it's been in the background for a while. What I don't think people understand is there is a basis for some interesting controversy about fluoride. What data shows recently, according to my dentist friends, is that if you put fluoride directly on your teeth, if a dentist sprays it on or applies it during a dental visit, that's more efficacious than putting it in the water supply and drinking it. So you get better rates of cavity prevention if it's applied directly to the tooth. Whether that shifts the dose or the amount you're exposed to, I don't know. But I know that there are more and more dentists who are saying, hmm, it might be most effective if you got it in your toothpaste, if you had it as an application when you go to the dentist. What are the ethics of that? Well, a lot of people don't go to the dentist, and poor kids certainly aren't going to the dentist. And when I had fluoride applied to my teeth on a previous dental visit, it cost me about 80 bucks. That's 80 bucks that a lot of people aren't going to spend, much less when they're not sure they can afford to go to the dentist. Plenty of Americans don't. I don't know the percentage. They're afraid of the dentist. They can't afford to go to the dentist. There are a lot of reasons why. But if you shifted our policy to saying, if you want fluoride, have the dentist put it on your teeth, what I worry about is you're condemning a lot of poor kids, poor people to a lot of cavities that could have been prevented. Maybe not as efficaciously as if they could have had it applied to the dentist's office, but it's the best we're going to do in a country that really has dentistry and oral health and visiting the dentist much more of an option for the rich than we do for the poor. I'm Art Caplan at the Division of Medical Ethics at NYU Grossman School of Medicine. Thanks for watching.